as we are hopefully coming out, I don't want to. Hopefully, we've learned a lot from the pandemic. Let's just leave it at that. As we come to the latter stages of it, it becomes an endemic, whatever that might be. We remember during this pandemic how it greatly exposed weak links in our healthcare system. And, these were weak links that we knew, and the healthcare industry has been talking about this for decades now, it appears. And obviously, you put everybody's healthcare system under enormous pressure with a global pandemic, and those weak links are exposed. And for the longest time, we've been we're so busy praising our healthcare system, and we should be the healthcare workers that are in it, but we're failing to realize that there are issues that need to be solved. And as we come out of the latter stages of this pandemic, how do we make sure that those problems are addressed? Not only for future pandemics, but for getting the system where it needs to be just to function in whatever normal conditions are. To talk more about the Ontario Medical Association's view and changes they'd like to see, let's bring in Dr. Rick Titus, Chair, District 4 of the Ontario Medical Association, Associate Clinical Professor, Department of Family Medicine, McMaster. And with us now, Doctor, thank you for the time. I hope you're well.
I am. Thanks for asking. Actually, I just recovered from COVID, so...
Congratulations.
Thank you very much. So that just speaks to the fact is that we're in the 6th wave of COVID. So COVID is still here. We're not endemic. We're still in the pandemic mode.
Since you brought it up, Doctor, clear this up for me, because I thought Omicron coming at Christmas time and, therefore January, whatever, that was the 4th wave. How did we get to 6?
Well, we don't have enough time on this show, but invite me back in another year. We'll be on the 9th or 10th wave.
Oh, man, I hear it. Because honestly, I was off for a week, and then I came back, and somehow I missed a wave. But anyway, obviously, this has exposed issues that were there long before COVID-19. Are you concerned? How concerned are you that now we are where we are, and whether that's wave whatever, that we're losing focus on where we were and the discussions we were supposed to be having around healthcare? And again, I know you were with the Ontario Medical Association, but this is virtually something that is countrywide, east to west, left to right. The Premier of BC was launching, at one time a few months ago, discussions into this with all the other premiers about something needs to be done to somehow fix the system. What is the thought of the Ontario Medical Association? Does it include a broader scope outside the province as well?
Well, we're trying to focus. Obviously, it impacts all Canadians. At the Ontario Medical Association, we're focused on Ontarians. And what we did was in 2021, we did a survey, and we surveyed, 1,600 doctors. We surveyed allied healthcare workers. We surveyed the patients or the people of Ontario, and some of the focus was that the agreement was that we have to deal with healthcare now. We understand, we appreciate there's going to be a cost connected to it, but we're willing to bear the cost now because there's issues we need to address. For example, there's 21 million medical services that have been delayed because of the pandemic. 21 million. So if our hospitals were working at capacity, or let's say over capacity, 120%, it would take 32 months to deal with the backlog. And that's not even considering the 5th and the 6th and the 7th wave of COVID. So right now we are underwhelmed, and our patients and the people of Ontario, the people of Hamilton are underserviced.
It seems that the discussion that we're having right now, it's moved from this to focus on pharmacare, dental care, and $10 a day care. And I don't want to lose the focus of our discussion here. But again, it seems that we're losing focus on what we have to concentrate on here.
Yeah, these are all important issues. But
absolutely.
Like Scott, what do I tell I'm speaking with my patient today Vola, and I was asking her, she was asking me, when am I going to get my knee replacement?
Yeah.
And so they have the acceptable target times. So in Hamilton, if you live in Hamilton, we're 40% over the expected target time that's acceptable to have your knee replaced. So we're above the provincial average. But what people don't realize, what my patients don't realize, that before I can make you that appointment to see the specialist, and when you do see the specialist, your waiting time is going to be 40% longer by the time you get surgery, just because we live in this region, I have to send you for an MRI. Well, how long will it take you to get an MRI? Again, in this region, we don't have enough MRIs. So the accepted wait time is longer here. So one issue compounds another issue, compounds another issue.
What is, and we've only got about a minute left here, Doctor, what is the short-term solution to this? How do we get through the next year of this, especially with the backlog?
Well, it's not only a short-term solution. We're trying to do, the hospitals are doing an amazing job. It's all hands on deck. But also, I think one of these solutions moving forward is getting one of these integrated ambulatory center, so that maybe we don't have to go to the hospital to get your knee replaced or your hip replaced or your cataracts or endoscopy. So we can build these centers, and these centers will provide us the great service. And the hospitals, what the hospitals can do is they can focus in on the complicated patients, on the complicated issues, thus freeing up space.
Do you think we'll have these discussions?
Well, this is the opportunity to have discussions because, Scott, there's an election coming. Politicians are listening. So this is our opportunity.
Dr. Rick Titus with us, Chair, District 4 of the Ontario Medical Association, Associate Clinical Professor in the Department of Family Medicine at McMaster. How do we get the healthcare system back to where it needs to be after a global pandemic? Doctor, thanks for the time and insight. Much appreciated. Be well.
And you too. And don't forget, invite me back after the 10th pandemic.
I'm going to take you up on that, Rick. Thanks so much.